My name is Matthew DiGiovanni, and today I'm going to be giving a presentation on learning disabilities, um, specifically Asperger syndrome and the autism spectrum. And I chose Asperger syndrome because I work as a one-to-one aide with a student who has Asperger's, so I thought it'd be interesting to learn more about the learning disability and about what he's going through every day and how he sees the world. So learning disabilities. As defined by the Individuals with Disabilities Education Act, IDEA, a learning disability is something that adversely affects educational performance. IDEA requires that schools provide special education services to eligible students as outlined in the student's Individualized Education Program, also known as an IEP. IDEA also requires a guarantee to free and appropriate public education in the least restrictive environment. And that just means that the student is included in as many activities as possible and is taken away from the classroom for either one-on-one or private group work as infrequently as possible. So Asperger's syndrome. Asperger's syndrome is an autistic spectrum disorder, and it's a subcategory of autism. Autism is characterized by social and communication deficits, fixated interests, and repetitive behavior. Asperger's syndrome is considered by many to be the mildest form of autism and is synonymous with the most highly functioning individuals on the autism spectrum. So the history of Asperger's syndrome. In 1944, Austrian pediatrician Hans Asperger observed 4 children in his practice who had difficulty integrating socially. Their intelligence appeared normal, but they lacked nonverbal communication skills. They displayed no empathy towards their peers, and they were physically awkward with their movements. Dr. Asperger referred to the condition as autistic psychopathy, marked by social isolation. Asperger's observations were not widely known until 1981, when Dr. Lorna Wing published a series of case studies where the children showed similar symptoms, and she referred to this as Asperger's syndrome. Asperger's syndrome became a distinct disease and diagnosis in 1992 when it was included into the 10th edition of the International Classification of Diseases, and in 1994, it was added to the Diagnostic and Statistic Manual of Mental Disorders. However, in more recent years, scientific studies have been unable to definitively differentiate Asperger's syndrome from highly functioning autism, and therefore in the DSM-V5, which came out mid-2013, Asperger's syndrome has been replaced in favor of a spectrum of autism, which is the ASD that we previously referred to. For simplicity, I will continue to refer to the learning disability as Asperger's syndrome, rather than speak about the spectrum of autism for this assignment. So learning symptoms. Asperger's syndrome often manifests itself through social interaction, which becomes the center of the diagnosis. In Asperger's syndrome, children lack normal back and forth conversation. They don't give the typical eye contact or body language or facial expression that is expected of a child that age, and they use repetitive behavior with phrases or objects and have an excessive attachment to routines or certain objects or interests. Compared with other autism spectrum disorders, children with Asperger's syndrome do not have significant delays or difficulties in language or cognitive development. Asperger's syndrome can often go undiagnosed because of this until the child or adult has serious difficulties in school, work, or personal life. And again, these difficulties can stem from their problems socially with groups. Misdiagnosis of Asperger's as ADHD is common until it becomes clear that the difficulties for the individual stem from their inability to socialize properly. Children with Asperger's syndrome may become isolated due to their poor social skills and narrow interests, and this isolation can cause problems in the classroom. So the child's needs. Early intervention for a child with Asperger syndrome can be extremely helpful in having them overcome barriers and learn to better assimilate. Um, Educational and social support programs for children with Asperger syndrome generally teach social and adaptive skills step by step using highly structured activities. Um, Occupational or physical therapy can also be helpful in overcoming physical awkwardness and mastering motor skills. And speech therapy is also useful for the student to overcome disjointed or monotone speech or other speech related problems. Asperger syndrome in the classroom. So the most important thing for a teacher with a student who has Asperger's syndrome is to remember that they're working with a child who may have some more needs than their other students and is slightly different. The student may be socially awkward with other students or the teacher, and examples of this can include avoiding eye contact when speaking to or being spoken to, um, and misreading or not understanding normal social cues. So an example of both of these would be a teacher correcting or reprimanding a student. And a normal social cue then would be for that student to look at the teacher in the eye and show that they understand what they're saying and that they are following along. And now a student with Asperger's may avoid that eye contact and may not be looking around. And so as a teacher or as someone dealing with this student, you need to understand that this is something that could happen, and you need to have an idea of how to work past it or how to accept that the student may be different and may not give you that eye contact to let you know they're listening. And so these difficulties can then cause them to become disruptive in class, and have you believe they're disobeying you, or they could actually be disobeying you. And then this can bother other students and disrupt other students in their work as well. Students with Asperger's syndrome may need more time on their assignments. This could be due to difficulties with motor skills like writing. They also have poor problem solving and organizational skills, and they have difficulty understanding abstract concepts and differentiating between relevant and irrelevant information. So when given a reading and writing assignment together, it may be difficult for them to read the questions and follow through with the reading and pick out what material is needed to answer those questions appropriately. Additional problems in the classroom may result from low frustration tolerance, poor coping strategies, poor concentration, emotional vulnerability, and restricted range of interests. And all of these are, of course, associated with Asperger's syndrome. So methods of accommodation. Due to difficulty concentrating and trouble with motor skills, like writing, teachers should allow students with Asperger's more time on assignments. Teachers should attempt to manage the classroom environment by providing consistency. They should attempt to avoid sudden changes, which can increase anxiety for the student with Asperger's syndrome. So something they could do is let the student, make sure the student's aware when we're changing classes, or if we have an assembly that day, or even possibly if there's going to be a fire drill, just so they're aware that there will be a loud noise at one point and that there will be a need for the students to organize themselves and exit the building in an appropriate manner. And that way, by letting the student know, there won't be the sudden change or the shock of the loud noise, or it won't be as shocking, and they'll be better prepared for this. Teachers of students with Asperger's syndrome should always state the obvious. It can be hard for students with AS to remember information from past experiences or based on using common sense. Therefore, giving extra information and guidelines to work can help them succeed, and it can help your job then be easier. Also, as with all students, be generous with praise. Tell your student what they did right. Using praise to correct your students and point them in the right direction, rather than correcting every wrong behavior and harping on the negative, will help them succeed and help them feel comfortable in the classroom. And compliment not only successes, but worthy attempts. An important thing is effort in the classroom. And if your student is showing that they're putting in effort, you need to be able to praise that and let them know that they're doing a great job and that you appreciate this effort. So family life. As with all disabilities, Asperger's syndrome can put stress on the family and it can affect each member in different manners. Parents and caregivers must place their primary focus on helping the child with Asperger's syndrome, and this can put stress on the marriage, on other children, work, finances, personal relationships, and responsibilities. Um, it can be difficult for parents and siblings to manage their time between the child with Asperger's syndrome and others. And so you might feel that your time is always dedicated to this child, or you might feel that it's wrong to leave this child with somebody else, or to put them in a care of another. Um, but you also have to remember that there are others looking out for your care, and that you also have to take care of yourself to be able to care for your other family. So creating this finding this balance between it can be a very difficult thing in the family life. Um, and because of that, it's important that parents have special individual time with each of their children, and that they should understand that the child with Asperger's syndrome may need to be left out in certain circumstances, but they will also get their own individualized attention and time. And an example of this might be if one of your children is in a play or some sort of production where it's necessary to be quiet for long periods of time. It may be unfair to your child, the other performers, and the other parents, and even yourself to bring your child with Asperger's syndrome to the venue if they will be loud and noisy and will cause a distraction. So it may be appropriate to leave them home and spend other time in that day or week with them. So future career and transitioning. For adults with Asperger's syndrome, social interaction and personal relationships may remain difficult. However, many affected adults do work in mainstream jobs and uh, make contributions to the society. Similar to modifying the classroom, the workplace can easily be altered to accommodate an individual with Asperger's syndrome. Examples of this could include providing specific instructions and explaining goals step by step to eliminate any need for inference. A boss should also be aware of how to deal with change. They should inform the worker of any adjustments ahead of time and try to incorporate small schedule modifications to prepare for larger changes that might come later on or that might abruptly happen during the day. And this working on these changes and becoming used to or allowing the worker to know of these changes ahead of time will reduce the anxiety for the individual with Asperger's syndrome. It's also important to allow for self-paced work or offer more time for learning new responsibilities for the worker with Asperger's. And there should also be time allowed for counseling or more frequent work breaks to avoid the anxiety buildup or any buildup of frustration. So as a conclusion, Asperger's syndrome is, again, an autism spectrum disorder, and it's associated with most highly functioning autistic individuals. The diagnostic focuses on social interaction and the child's lack thereof, or the abnormal aspects of that social interaction. And many of the problems can stem from this. A student with Asperger's syndrome can show average or above average intelligence, and unlike autism, it does not have significant delays or difficulties in the language or cognitive development. And again, in mid-2013, the Diagnostic and Statistical Manual of I just ruined it.